Since the start of relief efforts, Oil Search Limited, together with other development partners, have been taking the lead in providing relief to affected communities. Today, its Managing Director, Peter Botten, provided an update on the progress of their support. He said in recent days, road access into some areas had improved, which he said would allow for more supplies to reach some communities.
We're still carrying out activities, and we'll continue that this week as what we consider to be first responder activities. We're really pleased to say that the roads are opening up and heavier material can be now delivered into various areas across the two provinces and Western Province, of course, 3 provinces. It's early days, I suppose, but it's something that I know the various committees that we talk to and are working with are very much aware and are building a capacity to manage. But in reality, it's really the front line. It's one thing to get material to Hagen and to Tari and others. Pleased to say that you can get much of that material now out by road, but there's still a use for helicopters.
However, whilst supplies are starting to reach communities, there are other issues that authorities will now have to deal with. Among these, the high level of mental trauma that these people face.
A lot of people are pretty traumatised, and I think they've been weakened physically and certainly challenged mentally since the earthquake happened. So their resilience is enormous, but there's only so much you can work through and manage. So I think there's an ongoing issue out there which we need to manage and manage as a collective.
Another issue is the imminent threat of an outbreak of water-borne diseases.
We're still seeing a lot of medical cases. We're seeing people suffering now from diarrhoea and, generally speaking, as a result of poor access to badly contaminated water, etc.
Among its relief efforts, Oil Search has deployed a dedicated medical team to reach affected communities. These teams have already noted an increase in waterborne diseases, with several medical evacuations already carried out.
We have a dedicated helicopter for medical issues, which goes around the villages, and that they're certainly seeing a number of cases of that and are treating them where necessary. They're brought back into Morrow for further medical treatment, and in certain circumstances they're medevac to Tari or Mendi, or Moresby, and we've had a number of medevacs to Moresby.